Together, these three awesome individuals that you are about to meet have lost a total of nearly 250 pounds with the help of our next guest, and that's Dr. John Pilcher with the Texas Center for Medical and Surgical Weight Loss. He is here this morning, and we are about to meet three incredible women who we're about to see some dramatic results.
They are awesome ladies, and that's why it's such a great thing to be able to help out with this surgery. And so these are ladies that have done a great job getting ready for surgery and changing lifestyle to get the most out of it.
Okay, so before we meet them and see their before and afters, tell us just a little more about the Texas Center for Medical and Surgical Weight Loss, the procedures that you perform and what you offer your patients.
Yeah, thanks. We're a group of 4 surgeons and 1 medical doc. We take care of all aspects of excess weight and the health problems that go with that. The main operations going right now are gastric bypass and gastric sleeve. They're done laparoscopically with little incisions for less pain and a quicker recovery. Pretty low risk and good health outcomes.
Okay, so shall we meet the ladies?
Let's do. That would be great.
So first up, we have a before of Gretchen. We want to show you the before. Here's Gretchen before she went to see Dr. Pilcher. And here is Gretchen today. Wow. Gretchen, you are smoking in that dress. My goodness, how much have you lost, if you don't mind sharing?
I've lost 86 pounds.
Awesome.
Wow. And Doc, what procedure did Gretchen have?
She had a gastric sleeve operation.
Okay. And I want to talk to you a little bit about the difference in a minute.
Yes, ma'am.
But Gretchen, tell me about just the process, how you're feeling. I mean, obviously you're so happy that you made the decision.
I'm very happy. I feel wonderful. Looking great is a bonus of that. It's hard work every day.
Yeah. And have you had to buy a new wardrobe?
Completely.
Darn it. Good for you.
Hard to look. It's fun shopping, but now you got to manage it and keep it up.
Well, you look just beautiful. Thank you so much for sharing your story and for being here today.
Thank you.
Okay, up next, Doc, we have Mildred, your patient Mildred, and we have Mildred's before. We want to show her before first. There's Mildred before. Check out Mildred after. Wow. Wow, so Mildred had the gastric bypass.
That's correct, and she's coming up almost a year after surgery.
And look, you've kept it off, you're feeling good. How much did you lose total?
96.
Almost 100 pounds, Mildred. Goodness, so what has life been like since the surgery?
Wonderful. I found myself again.
You did?
I'm me, myself again. I feel great. I can do exercise. I can do a lot of activities with the family.
Sure.
I feel wonderful.
Well, you look beautiful.
Thank you.
You so much for being here today.
Thank you.
Awesome.
All right. Yeah, definitely a round of applause. And finally, we have Claudia, who is another one of your patients. We want to see Claudia's before. Here was Claudia, and she's a mom, I take it. And how much weight did Claudia lose? I think she lost 120 pounds. Look at her. Wow.
Thank you.
Claudia.
Thank you.
Goodness, so you're a mom.
I am a mom of 2 daughters.
Was that part of the reason that you decided to have this procedure?
Yes, it was. I couldn't get on the floor and I couldn't play with them, and I definitely couldn't be active with them the way that I wanted to, so they were a big inspiration for why I chose to have the surgery.
Okay, you've given me goosebumps. You look amazing.
Thank you.
Absolutely amazing. Those are incredible results. How are you feeling now? How is life different?
Life is very different. August will be 8 years since I had surgery, so my whole life is different. From eating, from exercise, from teaching others, helping others, and kind of being an advocate for anyone who wants to change their life.
Wow.
So it's wonderful.
And you have some very active girls now.
Yes, I do.
8 years later.
Yes, I do.
So you're probably chasing them all day long.
This one right here is 13 now, and her little sister's 8, and they are both very active.
You look gorgeous.
Thank you.
Thank you for being here. Congratulations.
Thank you.
I know it's been hard work, especially keeping it off for
absolutely.
8 years,
Thank
for 8
you.
whole years. So Claudia had the gastric bypass as well, and we just have a little more time, Doc, but if you could just tell us the difference between the sleeve and the gastric.
Sure. So first of all, the similarities are that both of them change appetite so that people just don't feel like they need as much food. That's a key thing about sustainability. In the sleeve operation, most of the stomach is removed, leaving just a small stomach, and some of the hunger mechanism that's abnormal, unhealthy, is removed with the sleeve. In the gastric bypass, there's no removal. There's just a reorganizing of the intestines. It's especially effective for diabetes. Diabetes can go away in maybe 48 hours after surgery. And both of them have been around for at least 10 years and good long-term results.
All right, well, if you would like to know, find out if you are a candidate, if maybe this is right for you, you can go and see them. Go see Dr. Pilcher at the Texas Center for Medical and Surgical Weight Loss. They're on 8811 Village Drive, Suite 300. There's the phone number, 651-0303, and the website, texasbariatric.com. And we also have a special offer. You can call now and get your insurance verified. So free insurance verification. If you call them, ask for Diana.
Right.
She's
Diana's
the lady that'll have the
Mm-hmm.
answer
She's
for
the
you.
one.
Again, 651-0303. Dr. Pilcher, thank you for being here. Ladies, Gretchen, Mildred, Claudia, thank you. And congratulations on your success.